Good morning. I'm Dr. Yoldas. I'd like to talk to you about labral or instability injuries to the shoulder. They're actually quite common amongst the active population, both young and old, and actually have some good solution or treatment options. This is the shoulder, the right shoulder. We see the clavicle, the wing bone, and the humeral head. The rotator cuff tendons are around it. But deep inside the shoulder, I'm going to remove this, we can see the socket. I'm going to use my hands further to explain. Within the shoulder socket, ball socket here, the socket's sort of like a flat dish, but around it is a ring of cartilage called labrum, sort of like a bumper that helps prevent the ball from sliding out. And it can get injured in two different ways. One, from repetition. So let's think of the baseball pitcher, the swimmer, or the volleyball player who each day thousands of repetitions of the shoulder can mechanically peel off that labral tissue. The other way to injure it is if we have a dislocation, which means through trauma, an accident, a fall, that the ball is displaced in front, below, or above the socket. And doing so knocks off that tissue, off that labrum. Labral tissue is a form of cartilage and unfortunately has very poor blood supply. So once damaged, it stays that way. So you can usually modify your activities and avoid pain and discomfort. So for the repetitive thrower, let's say, they may say, hey, I run, I bike, I do other activities without pain or discomfort. But as soon as they're to do something overhead to try to return to throw at a high level, it may limit their abilities or their full function. So in a baseball player, they may notice their velocity goes down, their accuracy goes down. In the other population where they've had a dislocation, the labrum tears in a slightly different spot. And unfortunately, we have a lot of data over the past 30 years to show that that instability remains. So despite being healthy, despite doing physical therapy, dependent on age, there can be up to an 80% chance of recurrence of shoulder instability. So in both cases, full function is limited unless the labrum is addressed. It is not a therapy thing, it is not an injection thing, or a biologic injection thing. It requires fixation. And for us, that's done arthroscopically, where we're able to repair through some absorbable stitch anchors to bring that labrum back to the surface where it belongs and reconstruct the bumper effect within the shoulder. It is done as an outpatient. People go home the same day. The surgery can take anywhere from 30 to 60 minutes. But you are in a sling for 3 weeks without any physical therapy. You can use your hand, type, write, and text, etc. After 3 weeks, the sling is removed and physical therapy is begun. Gentle strengthening, gentle range of motion. By 3 months, back at the gym, and by 4 months, begin aggressive overhead activity, whether that means starting a throwing program, swimming laps, etc. If done correctly, in the right clinic with the right physical therapy, the odds of success of returning somebody to full function are very high, almost close to 90 to 95%. So in the scale of our treatment, we go from a situation which could have a 90% chance of problems, instability, pain, to a near 90-95% chance of complete solution. So in a way, it puts a smile on my face because this is a very solvable problem. So if there are any questions or any issues with labral tears or damage, we'd be glad to talk to you about it. Thank you.